Are you treating your arthritis pain all wrong? If you don't know whether you have osteoarthritis or rheumatoid arthritis, chances are you are. Here's how to tell the difference and why it matters for your health. You know those aches in your joints that just won't go away, the ones that your doctor casually dismissed as just arthritis? I've got news for you, not all arthritis is created equal. In fact, confusing osteoarthritis with rheumatoid arthritis could be the very reason you're still in pain. I'm Dr. Michael Bell, and after helping thousands of patients overcome chronic pain, I can tell you that understanding the difference between these two conditions is crucial for finding real lasting relief. Today I'm going to break down exactly why osteoarthritis and rheumatoid arthritis are so different, and more importantly, knowing the difference could be the key to finally reclaiming your life from pain. So let's start with osteoarthritis, the more common of the two. Think of osteoarthritis as the wear and tear type of arthritis. It's what happens when cartilage in your joints, break down over time, usually due to age, injury, or overuse. What you need to know about osteoarthritis is it typically affects one joint at a time, so it's most commonly going to be a weight-bearing joint like your knees, your hips, or the spine. The pain is usually develops slowly over years, and it gets worse with activity. Generally, it's going to have morning stiffness type of pain, and that typically is going to last about 30 minutes. You can see osteoarthritis on an x-ray, and it shows up as a narrowing of the space between the bones, which indicates cartilage loss. In contrast to that, we have rheumatoid arthritis, and this is where things get a little bit interesting, because rheumatoid arthritis isn't just joint wear and tear, that's part of it, but it's also an autoimmune disease. And so what this means is rheumatoid arthritis doesn't just affect one joint, it often affects multiple joints, and it's typically going to be in what's called a symmetrical pattern. So both hands, both knees, both wrists or fingers, or whatever joint that it happens to affect. Now the onset can be rapid. Sometimes it can seem like it happens overnight. You also get morning stiffness with rheumatoid arthritis, but it lasts more than an hour. It's pretty constant usually. And rheumatoid arthritis can cause systemic symptoms like fatigue, fever, and weight loss. Rheumatoid arthritis is also visible on an x-ray, and that shows up as erosions around the edges of the joints, but it doesn't always show up like osteoarthritis where we see destruction or thinning of the cartilage in the joints. Now, understanding the difference between these two is crucial, because that actually determines the treatments for osteoarthritis and rheumatoid arthritis. And this is where with osteoarthritis, we're primarily focused on managing pain and preserving joint function. So you might do things like physical therapy, you might try weight loss to reduce stress on the joints. We can use anti-inflammatory pain relievers, or NSAIDs is what they're called. So you might use NSAIDs. In some cases, regenerative treatments like PRP, A2M, or cell-based therapies. Now with rheumatoid arthritis, since we're dealing with an overactive immune system, the treatment is going to be a little bit different. Generally, you're going to be seeing a rheumatologist at this point, and they'll be using things called disease-modifying anti-rheumatic drugs. They may also use biologic agents that target specific parts of the immune system, and it's generally going to be a more aggressive approach to prevent joint damage. But things get really interesting here, because in my practice, we actually have found that an integrative and functional medicine approach can be incredibly effective for both types of arthritis. For osteoarthritis, we focus on natural anti-inflammatories, joint supporting nutrients, and therapies that promote cartilage regeneration. For rheumatoid arthritis, we dig deep to uncover what's triggering the autoimmune response. This could be things like food sensitivities, gut issues, or environmental toxins. Those are all huge contributors to autoimmune disease. But here's the bottom line. If you're struggling with joint pain, don't just accept a vague diagnosis of arthritis. Knowing whether you're dealing with osteoarthritis or rheumatoid arthritis is crucial for finding the right treatment approach. And remember, every person is different and each case is unique. And that's why in our clinic, we take a personalized root cause approach to treating both osteoarthritis and rheumatoid arthritis. If you're tired of living with pain and you're ready for real solutions, then it's time to dig deeper. And in my next video, I'll be sharing the top 5 natural treatments for osteoarthritis that most doctors don't know about. Hit subscribe so you don't miss it, because trust me, this information could be game-changing for your health. And until next time, I'm Dr. Michael Bell, reminding you that understanding your body is the first step to healing it.